Hi, I'm Dr. Simon Moore. Welcome to July 2021 CFP Distilled. We're going to take the top clinically relevant articles from this month's CFP journal and summarize them for you. When I see a patient in my clinic, sometimes I quickly realize that there's actually two people in front of me that need help. Caregiver burnout is a real challenge that we're seeing a lot more of these days. Here are 4 questions that I ask caregivers, and you can ask too, to find out how they're doing. On a scale of 1 to 10, how able are you to cope right now? Who helps you right now? Do you have a family doctor? Do you know where you can find crisis support services? What do you see in your future? Asking these questions can help me identify who's struggling. And if you see a friend who you think needs help, ask them, are you okay?
The bigger the bump, the bigger the risk. Excessive gestational weight gain is a big problem in North America. What are the risks? Risks for mom include increased risk of C-section, gestational diabetes, pregnancy-induced hypertension, thromboembolism, postpartum weight reduction, and long-term metabolic outcomes. Risk for baby include higher rates of spontaneous abortion and stillbirth, macrosomia, neonatal metabolic abnormalities, and childhood obesity. There are many barriers for success on both sides of the relationship between the primary care provider and the pregnant patient. Depending on their pre-pregnancy BMI, total weight gain should be between 5 to 12 kilograms for women. Studies show that only 1 in 3 women receive weight counseling support from their providers, so don't forget this important step.
So your child has swallowed a coin battery or a metal object. How do doctors know what to do? The rule of thumb is if it reaches the stomach, then it's likely to pass on its own. But if it's a button battery, these can dissolve within minutes and can burn a hole in the esophagus. So if they swallow a button battery, call 911 immediately. When you call 911, sometimes they recommend giving honey to a child who's just swallowed a button battery, as that can be protective. Magnets are a different story. A single magnet usually passes on its own. If multiple magnets are swallowed, though, they can get stuck together with some bowel wall between them, and that can cause damage to the guts. Something that's sharp on both ends is typically removed. Interestingly, when some things have a sharp point on one end and a dull point on the other, in some cases they'll pass through completely safe with the dull end leading and the sharp end trailing behind. Needless to say, the patient's symptoms always play a large role in the assessment of what to do next. So, in every case, check with your doctor.
So that's it. I hope you enjoyed this month's CFP Distilled. Next month, August 9th, 5 p.m. Pacific, 8 Eastern, we're doing a special 30-minute session for residents, R1, R2, about all the latest changes to the exam and the virtual SOO. Make sure you sign up on the link below.